I am Dr. Heather Moore. Tonight we're going to talk about what to do when you roll or sprain your ankle. This is a really common thing that happens, and a lot of times I see crutches and air casts involved, and that's really more of a detriment than it is anything that's helpful. So one of the things that we've been taught since we were little is when you sprain your ankle, you rice it. You rest it, ice it, compress it, and elevate it, which is not a bad thing to do. Especially if it's a grade 4 sprain. It's really, really painful. I've done one of those. It was horrific. But, you know, you kind of feel like your ankle is broken. Most of the time it's just a sprain. While resting it, icing it, compressing it, elevating it is good, it's not the answer, totally. So when you roll your ankle, chances are you're not just going to be able to head to the couch, lay down, and put some rice on it. Now, if you're on the athletic field, maybe you can do that, and that's great for the first 15 minutes. Go ahead and do that. But when we get into crutches and air casts, it's really detrimental to actually use those things. So it beats limping. I understand that, but what you want to do is you want to get weight on it as soon as possible. And I know it's the last thing you want to do, and I've had one of the worst sprains ever. But the worst thing you can do is just kind of limp around or hobble around on it without putting weight on it. It's actually going to cause things to not heal properly and take longer to heal. So what you want to do is you want to make sure that, first of all, nothing's broken or torn, because then that does require a boot or a cast or some crutches. So in those events, yes, I'm just talking about a roll or a sprain of an ankle. The doctor says, oh, you just sprained your ankle. Air cast is not necessarily for you. Crutches are not necessarily for you. You want to get it back to moving as quickly as possible. So I'm going to take you through a couple things you can do right away, and these are going to be painful. I promise you these are going to hurt, and I know that's horrible to say, and nobody wants to hear that, but this is going to, one, help you recover 100 times faster. Two, help you actually recover in a manner that's going to not cause compensation or further issues down the road. And three, it's going to allow you to walk, okay? So what you want to do is anytime you roll your ankle, you do want to put that rice on it, that rest, ice, compression, elevation, 15 minutes, and you can do that a couple times during the day, but most of us live in the real world and we have to be up and moving. So kind of, you know, a lot of people like to do this when they have the ankle sprain and they're barely putting weight on it, they're walking on their tippy toe. So the first thing you want to do is you want to get your foot flat, all right? So depending on how intense the sprain is, this may be the last thing you want to do. And you might want to, you know, you're just going to want to do this and barely put any weight on it. So this may be enough of an activity for you, just putting a little bit weight on it with the foot flat, all right? So I recommend standing at a counter or something you can hold on to. So if you need that extra support, you're able to do that. So all you're going to do is you're just going to start like this, and you're going to shift as much weight over as you can. Now, in the beginning, after you sprain your ankle and it's really fresh, just putting a little bit on it may be enough. Just the touch of the floor may be enough. You may get pain just with having some weight all the way through your foot. That's okay, all right? You just sprained your ankle. It's not going to feel great. You want to just put as much weight as you can until you're basically standing on that ankle again. This may take 2 days in order for you to be able to shift it back and forth where it is nice and easy, okay? Where it's not horribly painful. The more you do this, the better, the quicker it's going to come back, all right? You are going to feel pain, okay? What you don't want to do is like grab onto the counter and kind of prop yourself up and then like do a little bit of this where you're like trying to lift your leg up, okay? That's not okay. You want to have your hands on the counter, and you just want to start by placing some gentle weight on there, nice and easy. Again, it could just be the mere placement of your foot on the ground that's going to cause you to, you know, have a little bit of pain, and that's okay. Start there. The next thing you're going to want to do is you're going to take that and you're going to kind of step it up a notch. So you're going to put that ankle that you rolled behind, and you're going to actually start to kind of push off. So you're going to simulate walking. Again, a lot of times when people sprain their ankle, this is how they walk, all right? After they're through the initial like hobbling stage, then we get the flat-footed like Frankenstein walk, okay? Where they're not really able to push off. This is gonna cause issues. So you wanna make sure that as you walk that you're working on pushing off. So the next exercise is all you're going to do is you're going to put that weight, as much weight as you can, and then come forward. Now you can do this simultaneously with the other one. So you can go from weight bearing, weight shifting back and forth, and then you can just kind of turn it and start to push off that toe. All right. So all I'm doing is just pushing off onto the toe, putting all the weight in the heel, pushing off onto the toe, getting that foot ready to push off and getting ready to walk normally. One of the things that you do want to do when you have a sprained ankle is you want to walk slower. And I know that goes without saying because so many people are just kind of hobbling along, but you want to walk as slow as you possibly can in order to have a normal gait. Now, I get right off the bat that's not going to happen, okay? But the more you're doing this, and the more you're hobbling, and the more you're on your toe, the worse it is. The worse you're making back issues that may not even have been there before, worse. The worse you're making ankle injuries, the worse you're making knee injuries, worse, okay? So even if you're walking as slow as a snail, you want to make sure that you're trying to get as normal a gait as possible. That's really important after you sprain your ankle, is trying to get back to that normal walking as soon as possible. The longer you stay on crutches, the more muscle you lose, the more problems that occur, all right? So putting on an air cast, putting on crutches, just be like, oh, I'm just gonna do this for 3 or 4 days, that leads to a lot more problems. It seems like a quick fix, it seems like it should be easy, but it's not, okay? And then the final thing you wanna do is after an ankle sprain is you want to come up and actually do some heel raises, okay? Really trying to work that ankle. And again, this is probably done in the beginning with you holding onto a counter and not having a whole lot of weight on that one leg and just more putting weight on the leg that's not sprained and just kind of going up and down, all right? Eventually, and you can even do this from a sitting position and just allow your foot to kind of go up and down. That's going to help with that acceptance and that push off on your toe. It's really important that you make sure that you're getting everything, you're doing everything you can, weighted, full weight bearing, partial weight bearing, to get that toe, to get that foot, to get that ankle ready to accept weight and be able to walk again. Really important, especially with rain, slippery conditions on fields, ankles roll a lot. The more you do these exercises right when it happens, and of course you do want to rice, but the more you're able to do these exercises, the better. And rice, right off the bat, is great. 24 hours later, you can do it a little bit, sure, but these exercises become far more vital right off the bat than if you just do rice alone.